We just left the clavicle. Now let's move to the scapula. Scapula is also known as your shoulder blade. So let's isolate that. Okay, notice that the anterior side of the scapula is very different from the posterior side. Couple of things to point out. So you know that this fossa here, which is called the glenoid fossa, is going to face laterally because it has to articulate with the head of the humerus, like so. Okay? And notice that you have this little feature right here, if I can get back to it, right here, called the Coracoid Process, which is on the anterior side. On the posterior side, you don't have that. It looks very different. Okay? Now, something you may be familiar with, even though you may not know you're familiar with, that's not it, is the spine of the scapula. You can see that under, it's very superficial, so you see that under someone's skin when they have their shirt off, like if you're at the beach or something. So it's very easy to distinguish the posterior side from, say, the anterior side. Okay, looking at your study guide, what are some of the features that you have to know? All right, well, let's start with the borders. The entire medial side of the scapula is called the medial border. And then opposite of that, you have the lateral border. And then you also have the superior border. If you know your directional terminology, it is very, very easy to learn those three borders. Coming here to the top, there are two projections up here you have to know. This projection here is called the coracoid process. And coracoid means crow's beak, and if you look at it, it sort of looks like a crow's beak. Posterior and superior to the coracoid process is the acromion or acromion process. Now, this acromion process articulates with the acromial end of the scapula. And I'm going to go back, and you can see it right there. See where the acromial end of the scapula articulates, the acromial end of the clavicle articulates with the acromion process of the scapula. By the way, you can feel that if you feel on your shoulder, and I highly suggest you do this. That's the highest point on your shoulder. You should be able to feel that joint right there. Okay, so again, I'll go through the terms you have to know. Medial border, lateral border, superior border, coracoid process, acromion, glenoid fossa. It says glenoid cavity, but glenoid fossa is the surface. The space between the glenoid fossa and the humerus right there, right, would be the glenoid cavity. But this is the glenoid fossa, even though it says glenoid cavity. So those are all of the bone features for the scapula that you have to know.